This film will explain how using contraception can help you plan healthy and safe pregnancies. I'm going to explain why planning your pregnancy is so important for your sexual health, starting with why it is important for younger women. Having a baby before the age of 17 can put the mother at much greater risk of complications in pregnancy and childbirth. They may even go on to lose the baby or die during childbirth. Women's bodies need time to recover between pregnancies, and also women who have more than 4 children are more likely to experience bleeding and other problems in childbirth and even death. Using contraception can help prevent against these problems. Sometimes people worry that knowing more about contraception might encourage people to have more sex and to have sex earlier, but we know that this helps people to make safer and more careful choices. Attending sexual health classes in your area means a trained health worker can help you to understand the different contraceptive options available to you and answer your questions. Here's my colleague Nurse Lenny Rose to tell you more.
I'm going to start off by talking about condoms. It's important to check that you've got a new condom every time you have sex. They're made of rubber and they go on to the erect penis just before someone's going to have sex. So you can see there's this little bit at the end that you squeeze the air out of. So you can see that when this is on the penis, it actually stops the sperm going into the vagina. The sperm's actually caught in the condom as it comes out.
Do you have to keep the condom on all throughout sex?
Yes, it's really important that it goes on before sex starts and stays on the whole time through. And you may know that sometimes a little bit of sperm can escape from the penis before ejaculation actually happens. And of course, it's important that at the end of sex, when you take them off, that you carefully remove them and dispose of them so that they don't spill any of the sperm inside. Next up, this is known as the coil. The coil is put inside the womb by a nurse, doctor, or other health worker who is specially trained, and then it sits where a baby would normally develop. There is discomfort when it is inserted, but then once it is in, you should not know it is in there. There is a risk of infection after it has been inserted, so please ask your health worker what signs to look for.
Doesn't hurt your body to use the coil?
Aside from this, no. These are very safe. They are used by many women worldwide. Next, this is an implant, and again, it needs to be put in by a doctor or a nurse. You'd go to your local clinic and it would be put into the inside of your arm, just under the skin. It can stay there for 3 years, and what it does is stop the ovary releasing eggs so you can't get pregnant.
Are there any side effects from putting an implant in your arm?
It's very safe, so it doesn't cause women long-term health problems, but some women do experience a change in their periods. The next method I am going to talk about is the injection. Like any injection, it can go in your arm or your bottom, and you need to have it every 3 months. It works very well, and similar to the other methods, it works by stopping the ovaries releasing an egg. Lastly, I am going to talk about contraceptive pills. You can see there are a lot of pills in the packet, and it's because they need to be taken every day. And it's really important that you remember to take them every day for them to work properly, and ideally at the same time each day.
How does the pill stop you from getting pregnant, and is there any side effects?
The pill works by stopping the ovaries releasing the egg every month. Most people don't experience any side effects with the pill, and people continue for years and years without any problem at all. So all these other methods of contraception do prevent against pregnancy but do not prevent against sexually transmitted infections or HIV. Condoms are really the only method that does both. But one thing about all these other methods of contraception is that when you chose to stop using them, you will return to being fertile and you will be able to get pregnant again at the end of it.
So remember, choosing what contraception is best for you is something that you and your partner can decide together. Using contraception to plan the timing and number of your pregnancies will help to keep you safe and healthy.